So you're in the ICU, fighting for your life, this stressful environment, this charged experience, and it really can leave a long-lasting effects beyond the physical illness. So I see it. I saw it mostly during COVID, and honoring and validating these patients, because they end up with PTSD after some of their stays.
Welcome to the Medical Trauma Support Podcast, where we come together to bring more humanity into healthcare. I'm your host, Sarah Stasica. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, I have Dr. Gerardo Garza with us. Hello, thank you for being here.
Hey, hi, Sarah. Thank you for inviting me. It's good to be here.
Yeah, I'm excited. So I'll tell the audience a little bit more about you, and then you can go into more detail if you want. But Dr. Garza is a critical care doctor and a pulmonologist, and I met him when I saw him signing these books outside of a bookstore I love in San Antonio. So this is his book, The Patient Survival Guide, How to Avoid Medical Mistakes. So
Yes, thank you, Sarah. It was. I'm glad we met and we ended up here and talking about this book and my goal, which is patient safety. That's what obviously got me into it. It's been early on in my training. I was very interested in patient safety since medical school. As you mentioned, as I progressed, I did internal medicine. I ended up doing a fellowship in pulmonary, then critical care. And really, I've spent the last 15 plus years of my life working in the ICU. So I'm still, a full-time practicing physician. I'm in a busy, hectic ICU, which is where the sick of the sickest get treated. So as you can imagine, I've seen a lot of cases, and all the complications that happen in the hospital end up with me in the ICU. And I think that also was one of the things that really pushed me to write this book. A lot of times, it's just simple interventions that can prevent having this type of complications that end up causing harm. So like I said, patient safety has always been my interest. And then later on, from my own personal experience, I wanted to share advice and tips to my patients on how to stay safe, how to try to prevent these things from happening when you're in the hospital.
Yeah, I think that's so important. And something that really surprised me when I was reading your book is that medical mistakes are the third leading cause of death.
I know, unfortunately, hundreds of thousands of people die every year. Over 200,000. That's what most papers quote. So that's that's unacceptable. And let me tell you something. Since I started this project and my training and all that, I think there has been a lot of improvement, and I definitely think that things are moving in the right direction. So this is something that's been more and more recognized, and the hospitals and the system, they try to implement protocols and safety guidelines to try to prevent that. But it's still a big problem, and it's something that can be a lot of times easily prevented. And that's what really doesn't sit well with me, where you see something and you think, oh my God, if they had done this, if they had asked the right question or looked at this, you wouldn't be in this situation. So that's where my focus came into, okay, let me try to prevent these situations, right?
Yes. Yeah. And I can already see from like what you shared, like why you wrote the book, but I was wondering if there was like a particular story or something that was really like, I have to write this book.
Well, like I was telling you, this is something that has been evolving over my training and my career. So initially, I think I read a book actually when I was in medical school. I don't remember the author. internal bleeding, which talks about, and this is years ago, right? But it talks about the epidemic of medical mistakes, and it goes into the different causes, and it gives actual real life examples. And some of them, and I think I quote some of them in the book, which are things that are unbelievable that should never happen.
Yeah.
And again, I as a physician, healthcare worker, I got into this to help people. So you think you see these things happening, and it
Yeah.
doesn't sit well. It's like, how's this possible? We're supposed hospitals are meant to be places of healing where you can trust your healthcare workers and feel safe, and yet some people end up being harmed. So that was a
Yeah.
real eye opener for me. And then that's what initially I think piqued my interest. And then over the years with my own personal experience in cases in the
Yeah.
ICU, it's something that I've been honestly wanting to do for a long time. I just until recently didn't really make the time to start working on it.
Yeah.
I try with my patients to give them advice and steer them in the right direction. But that's only one on one, whoever I'm treating at that moment, whoever is in front of me. So that
Yeah.
I wanted to get this out to a larger audience. And I think people would really benefit from simple steps and advice. And not only discussing mistakes, but even, any type of complication, and also to make your healthcare experience better. So, what do you need to ask when you go see your primary doctor? How do you prepare for an office visit, for a procedure? What do you need to do? How do you find the right hospital to get treatment, the right doctor? Because again, you put in a little bit of research up front, and then you prevent other problems down the road if you get set up with the right physician for you in the right hospital, you ask the right questions. So I talk a lot about that as well, just trying to make the whole experience for patients better and safer.
Yeah, I have like a lot of thoughts and I hope I can remember them all. But one of them is, before I went back to school and got my master's in social work, I was a doula. And so I was with people in the hospital as they were in
Yeah.
labor.
Hmm.
And so I was seeing this very wide range of experiences with different medical providers, different hospitals. And that was one of the things that really stood out to me was how, you know, I remember one doctor like just hanging out and chatting with me and the
Mm,
client and was very like, what questions do you have? Very open, wanted to
right.
know about more about how the client was doing, asking me questions about myself. And I just thought, what a wonderful experience. And then I had other experiences that were the opposite, right?
Right.
And
Right.
and so I loved that you talked in this book about ways to find a hospital that's a fit for you, ways to find doctors that are a fit for you. And what I really loved, and I would talk to people about this as a doula, is if you find a doctor that isn't a fit and you don't feel safe and you don't feel heard, you need to find a different doctor.
Correct.
And you talk about
Mhm.
this in that book.
Well, because I see it in my practice too. I don't do primary care, but sometimes my patients, from some occasions, they'll tell me I don't feel comfortable or they don't listen to me and this and that. Well, you
Mhm.
can change doctors, and a lot of people just don't think about it or don't want to do it, or they're shy or they don't want to be labeled as, oh my God, you're gonna think I'm difficult. And no, I mean you gotta find somebody that is the right. It's about the right fit and communication style. So, I mean,
Yeah.
there's a lot of different styles out there, and a lot of patients may feel more comfortable with certain type of doctors, and it's just about finding the right fit. I think communication again, it's a big component of patient safety.
Yeah. And then the other thing that you talked about and you have in the book, and I want to tell listeners that the book is really clear. And I want to tell you this too. I
Uh,
think you did such a wonderful job of making it very clear and how, like, at the end of each chapter, you have bullet points. There wasn't any part of the book where I was confused. It was clear, it was concise.
mm.
It was nice to read. So, congratulations on that.
Oh, thank you, thank you.
Yeah, but one of the things that that really stood out to me because it's very similar to conversations I have with people who've experienced medical trauma and may have
Hmm.
medical PTSD is that it's really scary for them to go back
Yeah,
into any kind of medical setting. And so part of what we talk about is how can you prepare before you go to your appointment? And
right.
so we talk about like write the questions down that you have because when your nervous system is feeling unsafe, you're not going to really be able to access like your prefrontal
Yeah,
cortex and be able to pull that information that you wanted to remember. So, um, I loved that you talked about that in the book. You talked about putting all of that on a piece of paper. And then
right.
I typically go another little step, and I've done this personally and talked to a lot of people about this, is I also have my little coping strategies written down,
Mhm.
right? So if I'm feeling uncomfortable, I have the piece of paper in front of me that says straw breath, sternum tapping, the things,
Right,
move your
right.
body.
Yeah, and then that's one of the things, like I was mentioning, is that how do you make the most of your office visits? So not
Yeah.
only preventing medical mistakes, but making the most of it. A lot of times, also it's very helpful to bring somebody with you. So if you have a significant other or whoever your healthcare advocate is, if they come in with you, some visits you're gonna get difficult news. You're getting diagnosed with something that's gonna be life-changing, a chronic condition. I mean, it's just hard to be there and think about the right questions or even remember what you're being told. So it's always
Yeah.
helpful, also if you have somebody that can go with you, if you can take notes. And like you said, just having coping mechanisms, your questions ahead of time. I
Yeah.
also tell them to write down the things that they want to address, right, during the visit. So ahead of time, you're like, hey, this is what I'm coming for. Then before I leave, I want to make sure we touch on this because sometimes the
Yeah.
whole visit comes by and it's over. Like, we didn't even talk about, this and that, which was the reason why I came in. So all that you can really make the most of your healthcare experience. And again, I mean, it's simple things. Some of them seem very intuitive. But still, a lot of people don't do it. I want to say most people don't do it. So but it really makes a big difference. It really makes a big difference on also how patients feel that okay, he listened to me, he addressed my concerns. We talked about what I wanted to talk. So that's
Yeah.
something very important.
Yeah, yeah, I love that. We've talked about this like way that people can prepare both,
Hmm.
by writing down what they want to talk about, ways they can also prepare emotionally by kind of having their coping strategies, having a medical advocate, or, just essentially what that means is bring someone with you.
Right.
Bring somebody to the appointment that you feel comfortable with, right? Somebody that maybe it feels soothing to you when you're with them and you know that they're going to be able to advocate, ask questions for you if you kind of get into a space where you're feeling scared, maybe shut down. You have somebody there who's going to be able to offer some support. So another question that I had, and I know this is something that you talk about in your book, is why complications do occur in medical settings. And I was hoping you could talk a little bit more about that.
Yeah, absolutely. One of the messages that I like to get across is that uh, I mean, pretty much all healthcare workers have your best interest at heart. Okay.
Mhm.
So when mistakes happen, even well-trained and well-intentioned professionals can make mistakes. And it's not always about the individual, but in general, our healthcare system is very complex. So there's a lot
Mhm.
of different players, moving parts, so to speak. So there's a lot of potential areas where things can fall through the cracks, so to speak.
Mhm.
You get to the individual level, then of course people who are being overworked and understaffed, and there's technical issues. but a lot of it is the system too. And I think one of the big problems is lack of communication. I think for patients, one of the most effective tools for safety is good communication.
Hmm. So tell me more about like for the listeners who are patients,
Mhm.
what does that mean to them? Like how can they step into like good communication with a care provider?
Yeah, definitely. Well, you want to make sure that you ask questions and that you speak up if there's something that doesn't seem right, if there's something that you don't understand.
Hmm.
Because again, I get in situations where maybe they don't fully grasp what's going on or why the treatment is whatever it is, and for whatever reason, oh, we didn't have time, I didn't want to bother him, they're shy, but that's a big barrier, and you really need to be open and be comfortable with speaking up. I think that a good physician should be open to answering your questions. I think there's still a little bit of I encounter people that feel like, oh well, I ask too many questions, they're gonna see me as someone who is distrustful. I don't trust them.
Hmm.
I don't like what, and that's not the case. A good physician will welcome that engagement
Hmm.
from patients. But it's again about asking the right questions and making sure you understand your treatment and why your doctor is doing X, Y, or Z test or giving you medications. Um, Really, I mean, the best defense against medical mistakes is a well-informed and engaged patient. So that's one of the big messages that I try to put out there.
Yeah, and that makes me think a lot about shared decision making and
Mhm.
that the patient is the expert on themselves
Oh
and
yeah,
their lifetime history. Like so only the patient coming in knows what their whole history has been. They know what their maybe traumas have been. They know maybe there are treatments that are going to be really challenging for them based on history. So, that shared decision making of the patient coming in as the expert on themselves and their
yeah.
life and what is possible, and the physician coming in as the expert in the field with the
Right.
treatment. Yeah.
It's a team. It's a team effort. So it's not competing teams. It's we're on the same team. How do we get this done? How do you help me heal and feel better and get better? But definitely that there needs to be engagement and participation from both sides.
Yeah, and I think that's where a lot of times people will be with a doctor and they aren't getting that shared decision making, and I that takes me back to what we talked about earlier in that if you can find a different doctor, that may be a time that you do. If you are trying to ask questions and you are trying to be a participant in your healthcare and you're running up against somebody who doesn't want to answer your questions or
Yeah.
seems irritated, it may be time to find somebody else
Oh,
who,
definitely.
yeah,
You have to be able to feel comfortable with your physician and your healthcare team, and you have to be able to speak openly
yeah,
and trust them. So definitely, if that's not there, then yeah, that relationship, that team is not gonna work. And it's always okay to get a second opinion or to see somebody
mhm,
else, and nobody is gonna blame you for that. That's just how it is, and a lot of times it's just personalities. It doesn't mean that it's not a good doctor, but maybe it's not the best fit for you, and it's okay to move with somebody else and look at other alternatives.
yeah. And then, one of the things that I've talked a lot about on this podcast is about systems that
Mhm.
aren't caring well for the medical providers working in them, and the compassion fatigue and the burnout and the moral injury that can
Yeah,
happen. And then sometimes when somebody is in this place of absolute burnout, they're not going to
yeah,
be as open to the shared decision making because they literally like are physiologically depleted
yeah. It's
So
not
that,
easy, and that's why I was mentioning that that medical mistakes can be related to how the system is set up.
yeah,
Um, I can tell that's very real. I can tell
yeah.
you that from being in the ICU during COVID. I was
Oh,
there. I was in the
yeah,
front lines, in the trenches, taking care of the sickest patients in the ICU and life support, and it's not easy. And luckily, I got through it, and I did well. But I saw it in other providers and colleagues that really got burned out, and it got to them. And
yeah. Well, one of the questions that I ask medical providers who are able to stay compassionate and connected is, what are your support systems? Like, how are you able to show up and in this way where you're being very thoughtful about the patient experience? Do you like, what do you do? What do you do to care for yourself?
yeah.
Your system do, right? What does the system you're working in do to
Well,
care?
well, first of all, I like what I do. So I go to
Yeah,
work happy because I really enjoy what I do and the people that I work with, and I feel like I'm making a difference, like I'm helping
yeah,
people. And that's why I got into medicine. Other than that, I try to lead a healthy lifestyle, still trying to, have some protected time off. I try to
mhm,
exercise, get enough sleep when I can, eat healthy, and just try to get by like that. But it can be challenging, and especially in like an ICU place,
yeah,
where again you're dealing with very sick, and it can be very emotional.
yeah,
People are very vulnerable, and the families and sad cases.
yeah,
So it can get to you sometimes.
yeah,
But at the end of the day, whatever the outcome is, if you put in the work, if you communicate, if you did your best, then you can still get by. And maybe things didn't turn out for the best, but you were able to still help them through those difficult times.
yeah. One thing I'm thinking about is I had a podcast episode with somebody who had been in the ICU, and she came on with her doctor who had
Oh,
been her
no
doctor.
way. Oh, that's great.
It
That is
was, I mean,
great.
I cried a couple times in that
Wow.
episode. It was so amazing.
Yeah. No,
And
it. Mhm.
the doctor, one of the things that the doctor said or did while Vanessa, that I should link this episode to that one so people can hear it. But
Mhm.
when Vanessa was in the ICU, her doctor and her husband, like she woke up and her doctor and her husband were hanging up pictures of her and her
Oh.
daughter on the wall
Mm.
for her to look at. And I just thought, oh my gosh, like in the most vulnerable time in
Yeah.
someone's life, like as the doctor, I think that's a privilege. Like that is a
Yeah.
privilege to being a medical provider, is that you are with people in some of the most life-changing, vulnerable moments of their life. And the way that you show up
Yeah.
has such a profound impact on them in that moment, but actually for the rest of their lives.
Yeah, no, it can be definitely emotionally charged moment, but and that's also one of the things because I don't only do ICU work. We've been talking a lot about that, but I have an office and I see patients in clinic. I have a pulmonary
Yeah.
clinic, so I see some of the patients that I cared for in the ICU, and it's great. That's the best. That's what really makes it all worth it. When you see that they come in and they're out of the hospital, they're feeling better, they're back to normal, and that's I mean that really means the world to me. And
Yeah.
and again, it's a very emotional a moment to walk that with the patients from the ICU to the outpatient, the clinic, keep following them. That's very
Yeah.
rewarding.
Yeah. And for their families. I had another person on a podcast who talked about her doctor while she was in the ICU and how her whole family tries to go to her checkups because, like, her
Mm,
big family, because they love this doctor so much. And
hmm
he was so wonderful.
Yeah.
and saved her life, and was just her experience was a really good one. Well, as good as it can be when you are fighting
Yeah.
for your life in the ICU. But yeah, so I think that's really special.
Right.
One thing I wanted, I'm sorry, you go.
No, no, go ahead. I was just gonna say, I mean that's really why most doctors get into this. I mean, you want to make a difference, you want to help people out.
Yeah.
But please go ahead.
Yeah, what I wanted to ask about is because you do have your clinic where you're seeing people after they've had these ICU experiences, I was curious about, you and I talked a little bit about
I
PICS,
know.
post-intensive care syndrome, before
Oh
we
yeah.
started recording. And like, how often are you seeing that in your
I
clinic?
that it's very real. I definitely see it. Going back to COVID times, for sure, I have patients that they will not go back to the hospital no matter what. That's how bad it affected them, and I don't blame it. So you're in
Yeah.
the ICU, fighting for your life. This stressful environment, this charged experience, and it really can leave a long-lasting effects beyond the physical illness. So I see it. I saw it mostly during COVID.
Hmm.
And I think I really respect that, and I think there's clinics popping up looking into this and how to follow these patients and how to help them from that standpoint. And I think that's very important. I think they're doing very important work in at the very least recognizing this, right,
Yes.
and honoring and validating these patients, because yeah, they end up with PTSD after some of
Yeah.
their stays.
Yeah. I love what you just said. I love that you said honoring and validating the patient's experience, because that is so crucial. And I've talked to countless people, right,
Mm,
about their experiences, their traumatic medical experiences, and oftentimes what was most traumatic to them was not the physical thing that happened, but how they were treated. And so
yeah,
when you talk about honoring and validating someone's experience, it can be as simple as that. Like, so for somebody to say, wow, oh my gosh, that sounds really hard. And like you said, like, I can understand why you don't want to go back. Those statements of literally just acknowledging and validating are so important. I think a lot of times people don't understand that, because like you're probably not hearing what I'm hearing on my side in my peer groups. So like when you say things like that, I don't think you understand how impactful they are to
yeah,
people. Like those kind words and the validation can be the thing that really shifts someone's experience from feeling like I can never walk into a system again,
right.
to that was really hard, but like I was seen as a human and I was like cared for emotionally as well as physically. It's really impactful.
Right, right.
Yeah. So, and I do want listeners to know, I will put in the show notes, I will put some links to some of the PICS, the post-intensive care syndrome resources, because like you said, there are more that are coming up, and and I can't remember the date, but there's a walk for PICS that happens now, like all over the world. There's a specific date that people do that. And then there are some like local walks where people can gather and walk to spread PICS awareness.
Well, yeah, because it's still under recognized, so that's why I think
Yeah.
it's very important to raise awareness. And I think again, it's things are getting better, but it's still not catching up to the reality of our healthcare system and the experiences of our patients.
Right.
So we need to
My
make sure, yeah, that they have a place where they can follow up and they can continue their healing.
Right. And referrals, right?
Hmm.
Like, so I think a lot about that. So, there oftentimes are social workers, case managers well, pretty much always in hospitals as people are being discharged. There's somebody giving them information, like you talk about in your book,
Yeah.
about what needs to happen at discharge. But what is often missing is the mental health or the
Right.
mental health resources. And I think that's really important for everyone. But I think when somebody's had an ICU experience, it's like there needs to be a little slot on that discharge paperwork that has mental health resources.
Oh my God, that is a great idea. I'm with you. Like I said, I live that day in and day out, and
Yeah.
that really needs to be there. You touched on discharge, and I think just a quick mention of that because I
Yeah.
think discharge is a very critical transition, and that's when a lot of mistakes happen. So you have to be extra vigilant when you get discharged about making sure you have the right medications. That's when the medication reconciliation is done, that you can get your prescriptions, that you understand the instructions. Sometimes, especially if it was maybe rushed or you didn't understand something, next thing you know, you're on your own, and that's when complications and mistakes can happen. So that's a very critical. I don't think a lot of people recognize that. They think, oh, okay, well, you're getting discharged. That means you're better and you're ready to go, and it's all good from here. But that period can be critical and can have also medical mistakes and follow up. Of course, you need to make sure you have proper follow up.
Yeah. I want to show the very back of your book that you have specifically so people can, is that okay if I do? If I show
Absolutely.
the So
Yes,
you
go
have a
for it.
little, well, you have a little sample medical information sheet, which is helpful. So, like, this is when we talked about preparation before appointments, before a hospital, going into the hospital. But then one of the things you talk about in your book is to bring the book if you know that you're going into the
Hmm.
hospital so that you have a place to put the notes and thinking about, like, in your chapter on discharge planning, thinking about things you need to write down
Right.
in the notes before you go so that when you are in that process of discharge planning that you're able to pull these notes up and say this is what I'm currently taking, this is what I'm doing, and I didn't know if you want to talk a little bit more about that.
Well, and that's why the book is it's as you previously mentioned, it's written in a simple manner because that's what I wanted to do, have a simple guide that people could take with them to the hospital and use it when they're actually in the hospital and take notes. Before writing the book, I read several books on this topic to see what was out there, and that's what I noticed. There's obviously other books. Some of them are, they read more like medical textbooks. I'm like, how's
Right.
that useful to a person who's hospitalized, has no medical training? So that's why I wanted to keep it simple and, take it to your
Yeah.
appointments, take it to the hospital, write notes. That medical information sheet that you showed, oh my God, if you have that, if you keep that and you take it with you to all your visits, that makes such a big difference. Keep that, please keep a medication list that's updated, that includes over the counter. And that's gonna be very helpful because that's another problem that can cause medical mistakes when you get prescribed something that interacts with one of the medications that you're taking, or you're not maybe on the right dose or taking the right thing, and I know, maybe it's surprising to some, but a lot of people, they show up, they're not even sure what they're taking. So
Mm.
it's always very important to have an updated medication list every time. If you go to the hospital, something changes, change it, go to your follow-up, make sure that stays current. So whoever you're seeing knows exactly what's happening, what needs to be done, what needs to be adjusted. If they need to
Mm.
start a new medication, they need to make sure that it doesn't interact with something else you're already on. And supplements include, any supplements over the counters that can also sometimes interact with medications.
Yeah, you mentioned that in the book, like supplements and herbs, different herbs people
Mm-mm.
take. I know like ashwagandha is one that people often take for stress. As
Yeah.
we are wrapping up our conversation today, I wanted to know if you have something that you really want the listeners to
Mm-hmm.
take. Like, what is like a really important message you want them to take from this conversation?
For sure. I want to make sure your viewers and listeners know that their best protection against medical mistakes is being well informed and engaged, and that their most effective safety tool is communication. So always make sure you ask questions if you don't understand something, speak up, get informed, and stay safe.
And then for people who want to know where to get your book, can you share where you're selling your book?
It's available on Amazon, paperback, Kindle edition. I recently opened an Instagram account. Mostly I share patient safety tips, a few of the things we discussed today. So that's Dr. G. Garza, D-R-G, Garza, like my last name. And I try to post useful stuff.
Great. Yes, and I will put those in the show notes. So I'll put a little link to the book, and I'll put a link to your Instagram account so that people can follow you and get more information about this. But thank you so much for sharing your time and your wisdom and all of that with us today.
Yeah, happy to be here. Thank you for inviting me.
Yeah, it's been great. Thank you so much for being here and for caring about bringing more humanity into healthcare. And if this conversation meant something to you, please share it so more people know they're not alone in their medical experiences. You can find resources, education, and our peer support community at medicaltraumasupport.com. And if you enjoyed this episode, please follow, subscribe, and leave a review. It really helps more people find this podcast. Take care of yourself, and I'll see you next time.